Good morning. I'm Susan Denser, and I'm delighted to be moderating today's discussion on the all-important topic of stress. We're coming to you from the night studio at the Newseum in Washington, D.C., and those of you joining us at home and online are the first to learn the findings from the American Psychological Association's newest report, Stress in America, Our Health at Risk. Since 2007, the association has commissioned the Stress in America survey each year. The survey examines the serious physical and emotional implications of stress. It goes without saying that stress is a part of all of our lives, and most of us also know that stress has a big impact on our health. Today, we'll discuss some solutions that could lessen this impact, including policy changes and more community support. Joining me today is a group of experts on stress, on physical and emotional health, and most important, on how our physical and emotional health are connected. Dr. Suzanne Bennett Johnson is the president of the American Psychological Association and a distinguished research psychologist at Florida State University College of Medicine. Dr. Norman Anderson is the CEO and executive vice president of APA. He's well known for his research and writing on the effects of stress on the development of hypertension. Dr. Catherine Nordel is the executive director for professional practice at APA. Before APA, Dr. Nordel managed a clinical and consulting group practice in Mississippi. Jonathan Lever is the vice president for health strategy and innovation at YMCA of the USA. Mr. Lever has been a chief architect in the wise response to the nation's lifestyle-related health crisis. APA invited all of you to attend this event because of your interests in primary care, in mental health, and disease prevention and management. We'll be taking questions from all of you this morning and hope that this is just the start of a larger dialogue about health policy solutions to stress that include behavioral and physical health. For those of you watching at home, you can submit questions via the American Psychological Association's Facebook page and on Twitter using the hashtag #StressAPA. So let's begin today's conversation with some key findings from Stress in America, Our Health at Risk. For that, we're going to turn to Dr. Norman Anderson, again, the CEO and Executive Vice President of EPA. Dr. Anderson, before we get to the findings, though, let's establish what do we mean when we use the word stress?
Well, stress occurs when we're faced with situations and circumstances in our lives that go beyond our ability to successfully cope with them. Now, we all need some challenges in our lives just to prevent boredom, to stay engaged, and actually to perform. And research has shown that at a certain level of challenge, when it goes up, we actually do better in our lives, particularly in our work. It's just when stress reaches a level that exceeds our ability to cope with it, and it goes on for a long period of time, when it's chronic, that we say that people are in stressful situations.
And we know more and more that stress actually translates into changes in our bodies, not all of which are good.
Yeah, that's one of the reasons we are very interested in studying stress and communicating how important it is. Stress has been found not just to affect us emotionally in terms of increasing depression and anxiety. It affects our behavior, and interesting new research is showing it has profound effects on every system of our body. It affects our cardiovascular system, our immune system, our endocrine system. A recent report came out just this week that showed that stress actually causes a reduction, a shrinkage in certain parts of the brain. So stress has profound effects on all aspects of functioning.
And as I understand it, these happen to be parts of the brain that actually influence what we're going to be experiencing in terms of hypertension or other symptoms.
Yes, and it's a logical extension. If stress negatively affects all these systems of the body, then stress increases our risk for a whole host of chronic illnesses that you'll hear about later today.
Okay, so we know this is really worth taking seriously. Let's go to the findings then of this year's survey. What are the top line results?
Well, it's really, what we found this year is really a good news, bad news story. The good news is, we started doing this survey in 2007. And what we found over the years is that there's a very slow, gradual decline in the level of stress Americans are reporting. It was when you look at that top level of stress, that extreme stress category, and in our survey we have a 1 to 10 scale with 8, 9, and 10 being extremely high stress. The percentage of people in that extreme stress category has gone down gradually every year, so that's the good news. The bad news is that nearly 50% of our survey participants are reporting that their own individual stress has gone up in the last 5 years, and especially in the last year.
It's kind of counterintuitive that stress levels would be going down. The economy's been miserable. There's a lot of joblessness. Do we have any idea what's going on?
Well, we're not positive, but what you have to remember is that when we started doing the survey in 2007, that was really the beginning of the massive recession we had. So people were already feeling and experiencing the effects of that recession. So the decline that you see is really from that extreme high back in 2007. But still, nearly 25% of the American public is saying that they experience extreme stress. And because of the large effects of stress on people, this is not good.
Now, this year's survey also asked some particular questions about the effect of stress on caregivers and on people with obesity. What did those results show?
Well, what we found this year, we really wanted to look carefully at a couple of subgroups. One of those subgroups are people we call caregivers. These are people who care for family members who are suffering from a variety of chronic illnesses, such as heart disease or cancer or Alzheimer's disease. Our research this year corroborates other research that has been done that shows that this group is one of the highest stressed demographic groups in this country. It's really quite remarkable to see the level of stress that they're under. The other group that's under a high level of stress are people with chronic diseases, including heart disease, but also people with things such as obesity and depression are reporting extremely high stress levels as well.
And we know we have plenty of reasons now to be concerned about obesity, with 2/3 of American adults either overweight or obese. It really is a crisis for our country. And Dr. Johnson, what does this mean then for individuals who are obese, as we've discussed, or have chronic illnesses?
Well, I think what the survey shows is that being obese or having a chronic illness at all actually increases your stress level. It turns out that over half of the people that responded to the survey said that either their own health problem or health problem in their family was a major source of stress for them. So if you think about that and then you add on top of it just all the stressful things that happen in someone's life, then you realize that having a chronic illness is going to be very difficult to manage. Added stress of the illness and then added stress in your life is going to make it very difficult for you to successfully manage your disease.
So a kind of a vicious cycle essentially takes off here.
Yes, it is a vicious cycle, and it's actually, the cycle is even bigger than that, because it turns out that behaviors that are linked to stress have a lot to do with whether you get these diseases to begin with. It turns out that about 80% of heart disease, 80% of stroke, 80% of diabetes is actually caused by poor lifestyle behaviors. If Americans would quit smoking, eat better, exercise more, we could actually reduce the number of people with chronic illness in this country.
Well, it sounds like all of that is obviously going to be desirable, but it's not going to happen without some policy changes or certainly some different ways of delivering health care to these individuals, correct?
Yes, we're very concerned about the way health care has been delivered in this country. I like to sort of think about it as the disease model of health care. If you have a disease, we are going to treat it with either drugs or surgeries, but we haven't successfully addressed the behavioral aspects of either having the disease or even getting the disease. So I think our healthcare system needs to focus more on people and less on disease.
So, Dr. Nordahl, it sounds like there's a role here increasingly to marry psychological interventions with what we would think of as strictly healthcare-related physical interventions.
Absolutely. As Dr. Johnson said, chronic illness is a huge problem in this country. We spend about 75% of all of our healthcare dollars on chronic illness. And when we have four major behaviors, alcohol and drug use, tobacco use, lack of exercise or sedentary lifestyle, and poor nutritional habits that lead to and exacerbate these chronic illnesses, we have a huge public health concern. It would be easy if we all, just as the old saying goes, just do it and change our behavior, but it's just not that simple. It's hard for people to change ingrained habits of behavior. So when we get stressed out, we need to take stock of what it is that's causing the stress. Are we managing it appropriately or not? If we're not able to make the changes we need to by ourselves, we need to consult our physician or a psychologist or another healthcare provider that can help people make the changes that they need to make. Because if you just can't do it on your own and you know you're running the risk of some really bad health outcomes, it's important that people take some action to get the help they need.
And the survey this year actually speaks to that topic, the importance of support networks and strategies really for supporting people, particularly among caregivers.
Absolutely. The caregiver group seems to do much, much better when they are plugged into some sort of a support system. They demonstrate less isolation, less loneliness, better coping strategies, less depression, less irritability, and less risk of chronic disease when they are plugged into the family and friends and other sorts of community-based support systems.
So, Jonathan Lever, the Y has been wading into this problem, exploring a number of strategies in response to everything we've been talking about, obesity, chronic illness, and so forth. What are the community-level interventions now that you all are engaged in?
Yeah, well, everybody knows of the Y, but what folks may not know about the Y is over the last several years, we've really moved from a focus on the sort of already fit population, the people who, if you gave them the keys to the YMCA, would be happy to go in and run on the treadmill, to folks that we call health seekers, people who really struggle to adopt and sustain healthy lifestyles. And as local Ys have begun to think about health seekers, the folks who need support and struggle, they've become more and more involved in chronic disease prevention programs. And so the Y in many communities across the country now has chronic disease prevention programs, primary, secondary, tertiary kinds of programs focused on individuals. Like we have a diabetes prevention program now, excuse me, that's now running in many places across the country. It's a group-based program. We have a program with the Livestrong Foundation that's focused on cancer survivors. We work with families on childhood obesity. And we also work at the community level to address sort of those policy systems change issues, more sidewalks, helping kids adopt policies that enable kids to walk to school. So working at the community level as well. And one of the things I thought would be interesting to share is some of the learnings that have really come from this work as it relates to stress. And it's really been touched on by Dr. Nordahl already, which is many of these programs are group-based. There is magic in group-based programs because people feel encouragement and support by others who are in the programs with them. In our diabetes prevention program, when people are scared to step on the scale, it's the group that encourages them, come on, get on that scale and let's see how we did this week. Another magic of community-based organizations like the Y is for people who are coping with the disease, not going to a hospital or a clinical setting to get an intervention really has important psychological benefits. So going to a YMCA where there are kids and families as you're wrestling with a disease is really uplifting and is different than going back to the hospital where it feels like, wow, I'm back in treatment again.
Now, the Y has a very important new partnership with APA in engendering a lot of this. Let's talk about that a bit.
Yeah, we've been really blessed to be able to work with the APA and their network of psychologists to run workshops, free workshops at local YMCAs to help families that are struggling with childhood obesity in their family. And we're working on a new program with APA and psychologists across the country to help people live well with a particular chronic condition. So we are thrilled to be able to be working with APA and others.